So we know that having these types of conversations about intimacy with nurses can be a challenge for patients. But what I also understand is that nurses also struggle, don't they, with having these conversations with patients. Why do you think that is, Mark?
So I think that can be very, very difficult depending on where the patient is and where you're trying to have the conversation. So if you're in a hospital setting, sometimes these conversations happen with people around, so you're behind curtains and things. That can be a real challenge to try and have a deep conversation when you're up on a ward and things at your pre-op stage and stuff. But also if you're doing it in the outpatients department, you might have a consultant trying to come in, you might have another nurse in the room. The patient might have brought a relative who's possibly not the most appropriate relative, like a son or a daughter or something. So trying to bring up intimacy and have those conversations, that can also be a challenge as well. And that can make it quite difficult for the nurse to kind of broach that subject in a good way to get a meaningful conversation out of it.
Yeah, so it sounds like it's important that the setting is right to have this type of conversation, because it is a private conversation. People don't often want to talk about private affairs with other people listening. It needs to feel like a safe space. And so maybe some preparations required where possible to make sure that the setting is right, which of course we know is not always possible. I think in those sort of situations, what you could try is speaking to patients about a range of things that they could be dealing with. So intimacy, diet, sleep, exercise, etc. And then just remind them that you can talk about it in more detail in your next session. But in the meantime, you're going to give them some information that where they can access more information or where they can access more support. In terms of the issues that nurses face as well, sometimes it could be like the nurses that have a complex relationship with sex itself. Not all of us are comfortable speaking about sex for various reasons. So we know that our upbringing impacts our ability to speak about sex. Also culture, religion. There are so many different factors, aren't there, that impact how we talk about sex and whether we even talk about sex at all. But what we have to be careful of is the patient's experience of our discomfort. How do you feel that nurses kind of work through that? Or do they work through that when they feel a bit uncomfortable?
Certainly the nurses that are aware that they need to talk about sex and intimacy, and they're looking on at their patient and there's maybe that big age gap and they're thinking, well, this could be my grandparent that I'm talking to or I'm going to talk to about sex. So I think it's really important for the nurse to maintain that professionalism without looking embarrassed.
Yeah, which can be really difficult, can't it? Because what we're asking nurses to do is to talk about something that really is quite private, and there is a lot of stigma around sex still. So it is a difficult conversation to have. But what I would say is that the more conversations you have about sex, the easier it becomes to talk about it. And so you can try initially by having those conversations, maybe with a partner at home, maybe with a loved one, a friend or a family member, maybe not conversations around sex that are too difficult for you, but just kind of start with something and then sort of see how you go. And oftentimes what you'll find is that when you're having conversations with patients, it flows easier because you're used to saying words like sex and orgasm and low sex drive and erectile dysfunction and things like that.
Would it be advisable for the nurse maybe to start off with it being a scientific, so talking about the science of sex, if you like, rather than having the emotion, the orgasm and so if you can introduce the topic, talking about the anatomy and why things might be difficult, would that be any good, or do you think that would sort of frighten the patient away and think that the nurse is just being a scientist?
No, I think that's really powerful. Knowledge is power. So when you're able to share with someone the science behind something, of course, you don't want to go too high level. You need to keep it basic. It helps them to understand what's going on in their body. It helps them to understand why maybe certain things aren't working in the way that they'd want it to work. But I think that you also don't want to shy away from feelings, because that also has an impact on their physical health and their mental health. you don't want to get into too deep a conversation about what's going on for them psychologically, because that could bring up maybe trauma that they may be experiencing. So you have to be quite careful. And I would say the best way to help your patient is to definitely to stick with the medical aspect of it, and then to gently ask them questions about how they're feeling and what's going on for them, maybe within their relationship that might be something that you can help them with, and then know where to refer them on to. I think that's really key.